Commissioner Baidoon.
Here.
Commissioner Anderson has requested an excuse. Commissioner Colleen.
Right here.
Chair Baker McCormick.
Here.
You have a quorum present. B, Chairwoman's remarks.
All right. Next item.
C, approval of the February 7th, 2023 meeting minutes.
So moved.
And moved and supported. And for the record, Commissioner Marecki is present. And it's been moved and supported. All those in favor? For the minutes? Yes, please vote.
Motion carried.
Next item.
D, unfinished business. There is none listed.
Next item.
Item 1, under new business, requesting commission approval of Amendment 2 to a one-year intergovernmental service provider agreement with Detroit Wayne Integrated Health Network.
Do we have someone here from the department? Okay.
That's better.
Got it?
Yes, thank you.
Good afternoon, Madam Chair. Melissa Fernandez, Division Director for Juvenile and Youth Services. And we are requesting the approval for the IGA to receive and distribute the funding for between DWIN and the county. This will allow Assured Family Services to continue to provide community-based services for our at-risk juveniles.
And does this also provide any services at our juvenile facility? Do they work with us?
Correct. So they
Okay.
work with us to provide the risk assessments and the mental health services.
Okay, great. Any questions from commissioners? Oh, yes, Vice Chair Commissioner Colleen, I'm sorry.
Thank you, Madam Chair. Yeah, we're all getting used to this hitting button stuff. So this is the amendment number 2 to this contract. So where are we with this contract? Is this an option that we're taking here for 1 year?
Not sure. Yes, is that what?
Yeah, because I thought the contract had generally been like 5 million. Is that correct?
I'll ask Cecily up here, who's our
Yeah.
administrator.
Let's see where we're at.
I'm Cecily Hoagland, Administrator in the Juvenile Youth Service Division. About 3 or 4 years ago, it was 5.2 million.
And
Based on our usage, it was reduced to from 5.2, I think, to 4 point something, and now it's 2.4.
that was based on encounter data?
Yes.
Okay. And now, and so now we're putting more money into it.
Well, we're putting less because it was at 1 point, like you.
Oh, okay, it's less for the year.
Yes.
So this is a continuation of reflecting, is this good news that there's less encounters? How do we interpret that?
Well, I think during the pandemic, our numbers were low.
Yeah.
So they adjusted the amount that we received based on our encounters. I think if you see that.
Okay. So I guess then it's possible, I would imagine things are picking up now that, and I'm not holding you in anything, but then I'm thinking we might be looking at Amendment 3, 6 months from now going, whoa, encounter data is back up and we need to put, so that's a possibility here, huh?
Yes.
Okay. Thank you.
If I can add, I think that's a strong possibility. We're working on our annual report and our data now to present to you, and you'll see that we do have an uptick in numbers.
Yeah, that's another month or so away.
Yes, that is in March, correct.
Beautiful. Thank you.
Commissioner Marecki.
Thank you, Madam Chair. And I have noticed that this is retroactive and wondering why.
Question. So it's retroactive as we were waiting for the board action on DWIN's part. And so the retro is DWIN getting that to us and
It is.
not on our part. Yes.
Sounds good. Thank you.
For the record, Madam Chair, I'm no longer on that board. But I think that's what happens. It happens with the, if I may, Madam Chair, it happens with the WIN because now you have two boards, two systems involved. Yeah. Slows it down. Thank you, Madam Chair.
Any other questions? All right, we'll take 1 and 2 to, it's a 1 and 3 together. All right. Next item, please.
Moving to the addenda, item 3, requesting commission approval of a local health department grant agreement with the Michigan Department of Environment, Great Lakes and Energy, Drinking Water and Environmental Health Division.
So Chair Baker McCormick, Avni Sheth, Medical Director for the Public Health Division. This is a request to approve our annual agreement with the Michigan Department of Environment, Great Lakes and Energy. This annual award supports various public health, environmental health programs, supports operating these programs primarily in the space of the safe water oversight that we do in Outwayne County. And it is, I'll get ahead of the question. It's retroactive because it came to us late from the state. It came right before this transmittal letter was submitted December.
Any questions from commissioners? All right, how many, go right ahead, Commissioner Vice Chair Killeen.
Thank you, Madam Chair. And just for the details, I think this mostly goes to water testing. Is that still the case?
So it supports a few of our programs that support safe water oversight and monitoring. There's a few programs that it gets distributed to. One is our monitoring and oversight of non-community water supplies. So these are water sources in communities that are.
Belleville Lake, I think we've always done.
Right, we do. It's mainly
These
wells that aren't private wells. They are public serving wells, so they could be supplying a daycare facility or a park, but they're not necessarily the community water supply, which is the municipality water supply, which we don't have oversight over. So this funding is through the state EGLE division that has oversight over this non-community water supply sources. And in addition, a big chunk of this funding goes towards monitoring of public pools. So all of our public pools, and then oversight over a piece of the waste management transportation. So the transportation of sewage and the trucks that transport them. So monitoring them, make sure that they're doing it safely.
Is that a new duty on the county? I hadn't heard in the years. Like you're doing some testing in Lake St. Clair for E. coli with these dollars? At beaches, right? And I believe also the beach out of Belleville gets tested.
I'm not sure if that's under our jurisdiction, that beach, but I can follow up.
Yeah, see, it was at one time, but I know these things bounce back and
Yeah,
forth.
we don't have many beaches under our jurisdiction from my.
But we would do testing on behalf of the state if they said, here's some money. That's.
Yes, or the operator of that entity would submit their water tests for us to review and monitor and survey.
Anything pop up in the last year with water quality monitoring around the county that was unusual?
Not in these programs.
Okay. We'll leave that go for right now. Afraid to think of what it might be, but that's okay. Thank you, Madam Chair.
Thank you, Vice
Thank you.
Chair Baydoun.
Thank you, Madam Chair. I A quick question. This amount of money, obviously for 43 communities, this is probably not adequate to support all of these programs in all 43 communities. How do you accommodate, this is just a portion probably of what you spend?
Yes, that's correct. We do have another award that is incorporated in our annual comprehensive agreement we get from MDHHS that includes some funding for our non-community water programs and our sewage program. So we kind of piecemeal it together there. In addition, these programs also serve private wells and private owners of septic tanks. And in those scenarios, we do have inspection fees and permitting fees. And so we kind of combine all of those sources to be able to do this.
Yeah, I know certain, as a real estate broker, I know that, that certain parts of Wayne County, they have septic and they have well water and they have to be certified before a property gets transferred. Okay. Okay, thank you. We'll make a motion.
Commissioner Marecki.
Thank you, Madam Chair. As far as the public pool testing, how about like the private public schools? Public pools, like Livonia's got several pool clubs that are actually private membership. Do you guys
Right.
do the water testing for those?
I can follow up with you. It depends on how the state defines that public pool. It could be, publicly owned entity or serving the public. So
Okay.
I'll get back to you on the
Okay.
exact definition.
And how often, do they just do it at the beginning of the season or do they go through
It-
on a time schedule?
At least once a year, we're trying to inspect all the public pools that
Okay.
meet that definition. There's over 500 in Wayne County. And obviously if anything comes up of concern, there's follow-up.
Sure. Okay, thank you.
Dr. Chef, if you could get us a list of the pools that we inspect and maybe the campgrounds, that would clarify most of it. And I don't know if you know how many that might be off the top of your head or.
So I know that we have about 560 pools per the last fiscal year. Campgrounds, I don't have that handy, but I can get that back to you. And that one is, it's the general inspection of the campground.
Thank you. There's been motion of support made and it's been seconded by Commissioner Marecki. We can vote. Yes, this is for both 1 and 3. Thank you.
Motion carried.
Next item.
Moving back to the agenda, item 2, an update on WIC services.
There's someone here or are they on Zoom?
No, I am here. Alicia Grinstead.
Okay, on,
I am in Zoom, I'm sorry.
okay, thank you. Thank you so much. All right, can you give your name and title for the record?
Yes, my name is Alicia Grinstead. I am the WIC program manager at Access in Dearborn, and Access is the Arab Community Center for Economic and Social Services. Thank you for having me today.
Thank you for coming. So can you just give us an overview of WIC services and your programs there?
Yes, am I able to screen share?
Madam Clerk?
Yes.
Yes, you are.
Okay. Give me 1 second. Okay. Can everybody see that?
Yes.
Okay. Just a little brief history of Access and WIC services. To begin with, Access has been serving the community for more than 50 years. It was started by a group of volunteers in 1971, out of a storefront in Dearborn's impoverished South End. Access was created to assist the Arab immigrant population adapt to life in the United States. Today, Access is the largest Arab American human services nonprofit in the United States. Prior to Access providing WIC services as a subcontractor, Wayne County provided WIC services at the same site in the Access Community Health and Research Center from 2003 until October 1st of 2009. Access acquired the county's ending caseload of 3,200 clients and reached its contractual maximum of 5,000 clients by the following June of 2010. Our current client caseload maximum is 5,700 and has been for about 5 years now. The Community Health and Research Center WIC office is located at 6450 Maple Street in East Dearborn between Warren and Ford Road. And our office accepts program eligible residents in the cities of Dearborn, Dearborn Heights, and also one Detroit zip code 48228, which borders the city of Dearborn on Warren Road. And we also accept any Wayne County eligible residents whose home language is Arabic. So primarily our office provides a unique service where we do have staff that are bilingual and can help the clients in regards to their language needs. So the last caseload closeout, which was in December of 2022, we were at 99.5% of our caseload maximum, or 5,672 clients. Some other services that we also provide with the help, of course, of Wayne County is that is the breastfeeding promotion and services. So we do have our nutritionists on staff who refer all pregnant women during their pregnancy and afterwards when moms deliver and decide to breastfeed. We refer these clients to our Wayne County peer staff for support education according to the policy of the program. We also have been providing manual and loaner pumps to our moms in the office and provide education during remote services. And I'll get to remote services and the timeline of that in just a minute. So in regards to the statistics percentage-wise of the race ethnicity that we serve out of our 5,700 caseload, approximately 41% of our families served have Arabic as their primary language in the home, which is 1,548 families out of 3,740. 88% of our clients served at this site are of Arab descent, 8% African American, 2% white, and 2% Hispanic or other. Our staff is unique in that it provides staff that has bilingual abilities, primarily Arabic and English. So about half our staff have that capability. 3 staff that speak English are staff that have been working in WIC for many years. For example, I'll give my age away somewhat. I've been working in WIC since 1983, and our supervisor has been working in WIC since the late 90s. So we do have some veteran staff on board to make sure that we run a good program. So in the full-time staff, as you can see, 4 bilingual, 3 English, and 1 bilingual with Greek and English. And we have 1 manager, which is myself. I'm also a registered dietitian, 1 supervisor, who's our nutritionist and CPA. We also have a new hire who is currently a CPA or a nutritionist, but she is a registered eligible dietitian. And once she passes the test, she'll be able to perform high-risk care plans and services to our high-priority clients. We have 4 administrative support staff that also serve as our lab technicians to do lab services, but during remote services in the past 3 years, we have not been able to do that since we only have some in-office services, not full services because of the pandemic. And finally, we do have 1 nutritionist who's bilingual in Arabic and English. We currently hired a person who will be part-time as our support staff and lab tech, and she is also Arabic and English bilingual. If you want to take a look at the next set of numbers, this will give you an idea of what was happening prior to the pandemic, the 3 years prior to the pandemic, and our current services, which are considered like a remote hybrid service. As you note, in 2017, these are the average annual closeouts for client participation at this office. Our goal is to get 97% out of 100% in regards to the contract language. So as you can see, in 2017 and 2018, we were very close to that mark. And then in 2019, we dropped a little bit. And one thing about WIC is that if the economy is running good and doing well, our WIC numbers will drop, and that makes sense. If the economy is not doing well, our WIC numbers will rise. During 2020, when the pandemic started, our doors closed on March 16th. So you'll note there that the client services dramatically went up, and we had 101% of the caseload during that year as an average. During that time, we stayed open from March 16th with some services to make sure that clients were getting their cards, their WIC cards. Clients had the ability to call us to see what was going on. And we did that and have been doing that since March 16th of 2020. Some clients would transfer into our office, and that's why our numbers jumped. And then we started to go down a little bit in 2021 and back up because of the economy of this year, 2022, up to 99% of our caseload. And then finally, what remote services have been looking like in regards to prior to COVID is that when we were working in office before COVID, before the pandemic, it required that clients came in for in-office services, physically present. They received the service in our lab, which was basically heights and weights and checking hemoglobin, which is a big part of our education and screening. And we have lost that, but we've kept going to make sure that clients receive their food benefits and their education as well as their referrals. And what's nice about having Access WIC program in our CHRC building or Community Health and Research Center, we have other programs that we can literally walk people over to and help with those referral services. So that's unique in a sense for our program. All staff has been in office at least 2 days per week at the start of the remote services. We ended curbside services in September of 2021. Then we've been pretty solid where staff will rotate in office 3 days a week and work remote twice a week. So at this point, our partial services continue. We plan to do a soft opening in June, which will bring back some of our clients to get them used to being in the office. Because mind you, we've had 3 years of clients that don't understand how WIC works and the fact that they need to really come into the office to get the full benefit of the service. And then we're hoping to open, we plan to open in July. We will not have any choice since the Public Health Emergency Act will be lifted, and then waivers for the program will be lifted. So about mid-July is when we'll plan to go fully back into an in-office service. At the end of my presentation, I was asked to make sure that I provided contact information, key contacts. You can see in our corporate office in the south end of Dearborn, our CEO and president, Maha Frage, our chief operating officer, Lena Harani Harajli. Our director of finance is who oversees and manages the WIC budget is Mary Maru. And then we have myself in this office here at Maple in Dearborn as the WIC program manager, and our director of services at the Community Health and Research Center, Mona Mackey. I appreciate your time. And any questions?
Thank you. Your phone number, the last digit, can you give us that?
Oh, I apologize. Yes.
That's okay.
216-2201.
2201. Okay. WIC and the qualifications to enroll in the WIC program, have those changed any prior, before or after COVID?
No, the only thing that's changed is that clients do not need to be physically present to provide their information. So for example, you must be a Michigan resident. You must bring in your ID to show who you are. You have to physically bring in your child and your baby so we know that they are here. And right now, during remote services, we are using what's called a waiver situation of a verbal attestation. So whatever the client tells us over the phone as their proof of income, that this is their child, this is their date of birth, that they live in Michigan, we are taking that as a verbal contract. But we also have the benefit of accessing the My Health benefits, so we can look up their Medicaid and see actually that is their address, this is their baby, this is the date of birth of the baby, the Medicaid number. And the fact that they have active Medicaid will allow them to be eligible for the program based on the income qualification. And the fact that they're a Michigan resident. So those are two parts that we can access on our own.
And what programs do you provide in-house? You alluded to some programs that they were not aware of, or your applicants, I guess.
So because we're located in the same facility as many other programs, we have a medical clinic. So it's not uncommon that somebody would go into the medical clinic and get a pregnancy test done, and then they'll walk over and sign up for WIC. We do have a program called Everybody Ready, which serves children from birth up to 3 years, and now has another aspect of that program to help support mothers who are also battling substance abuse with small children. So we can have those programs available to us where we can literally walk over to the person's office and let them know about a client and, perform that type of referral one-on-one, which is unique. But we're looking forward to getting actual clients back into the office, because that's where we do our best job, where we can physically see what's going on. We can read people in terms of like, how is a child acting in the office in terms of their development? Are they understanding speech? So we also have a domestic violence program here, behavioral health here. We also have victims of crime acts here. So people that are suffering from PTSD from either overseas coming here or any kind of traumatic situation. So what's unique is that we can do those types of services in the building. And we have like an inner office type of referral where we can do that immediately. In addition to Medicaid services and social services, which is across the street from us in our same area of our parking lot.
Thank you.
Mm-hmm.
Any commissioners have, Vice Chair Pro Tem Baydoun?
Thank you, Madam Chair. Thank you, Alicia, for this great presentation. Having served on the business committee at Access in the mid-90s, I'm very familiar with all the good work that Access does in Southeast Michigan to help families. I have a couple questions.
Sure.
About 1,548 families, I believe you mentioned that they were of Arabic descent, or main language was Arabic. I'm just curious, does your program cover refugees that came to this country, but they don't have legal status? Like people from Afghanistan, for example, they're not considered Arabic, but they would probably fit under the other 2% maybe?
Yes, we do. We have been taking some refugees from Afghanistan, and that was actually something that was brought to our attention through the WIC program at the state level, letting us know who was going to be coming in as refugees in all parts of the Tri-County area, in addition to like Washtenaw outside this area. So we have had a handful of refugees that come into our services. Primarily, they start in the medical clinic, and then they'll refer them to us here. But there's also other WIC agencies in this area, in the surrounding Detroit area. I know ACC has taken some clients as well as refugees, but we do represent we do serve not only the Arab community, but because there's such a large community here in Dearborn, that's primarily our base. We do not discriminate against any other races or ethnicities. So the refugees do have the ability to receive WIC services regardless of the fact that they're not citizens. That has nothing to do with WIC. You do not have to be an American citizen to receive WIC services as a woman, infant, or child under the age of 5.
You also, I think, the chairwoman touched on the income threshold. Is this like used along the poverty guideline? For example, a single mom with 2 children, what is the threshold of her income to qualify for WIC?
Yes, so in regards to the income qualifications, if you are Medicaid eligible, receives food stamps or cash assistance, you automatically qualify for WIC. We are at or below 185% of the poverty line. So for a woman who's pregnant, she's technically a family of 2. So we count them as a family of 2. With baby, if she had twins, it would be a family of 3. And so off the top of my head, I'm trying to think, I don't have the guidelines, but I would have to check and see for you. I would say for a family of 2, it is approximately, I think it's about $12 or $13 per hour at a 40-hour work week that would qualify that person. So I want to say it's in the low 20s that they would still qualify for WIC. And I will try to do that right now for you. So
I was just curious, that's all. You don't have to.
actually about 22,000 a year. So it is
It
for.
sounds,
Mhm.
I'm sorry, it sounds like you have a good verification system in place to make sure that this program is not abused by people who are not qualified to receive aid from this program.
Yes, we are. Prior to the pandemic, the proof of income needed to be brought in. So if a person did not qualify for Medicaid or food stamps, they could still qualify for WIC, but they would have to bring a check stub within 30 days of the appointment and to show a gross income. And then we'd consider family size as well. So we do an extensive review of their finances. We do not look into social security numbers or anything like that. If they're already Medicaid approved, that's already been done, so we don't go beyond that. But you can still have WIC services even though you don't receive any public assistance. So that's unique about the program as well. So you may qualify for WIC, but you may not qualify for Medicaid.
If a refugee family lives outside Wayne County, they cannot qualify to receive through Access the WIC. They have to go to a different organization.
They do not. So it is recommended that you go to the WIC office in your community, in your area, in your county, just to keep caseloads balanced. But technically, the program is set up that if you lived in the UP and you wanted to come down to Access or any WIC agency in Wayne County, you could get onto WIC in any agency, any county. You cannot deny a person that service.
Thank you, Alicia. Keep up the good work.
Thank you so much. I appreciate it.
Thank you, Madam Chair.
Thank you, Commissioner.
Thank you, Madam Chair.
Commissioner, we have another question from
Sure.
Vice Chair Pro Tem Colleen.
Sorry, I took your job, Commissioner Baydoun. Ms. Grinstead, thank you very much for being here today. Can you send over a quick little following up on Commissioner Baydoun's question? How you qualify for WIC, what all the standards are?
Yes.
I'm sure you have a 1 or 2 page thing that does that.
I do have, let me check in should I stop sharing at this point?
If you could send it over, just having it on
Yeah.
the screen. Yeah.
Let me see. If I can see it.
Does WIC cover the breastfeeding services? Does that come directly under you?
So in Wayne County, it does not come directly under us. We use the breastfeeding services who we subcontract under, which is Wayne County. And we utilize their breastfeeding peers. And so what happens is that once we do a referral, we have a specific peer that's assigned to our clinic that is also bilingual, and that we use that peer to send information. There's ways to put notations in a client's file to indicate why that peer needs to call this client. So we do a referral within the system. We can email or call the breastfeeding peer that's assigned to our access agency here. And then we can also have that peer read notes in the file why the services are needed. So we utilize the peers, and I believe they're contracted under SEMHA.
Okay, yeah, because I'm curious as to the progress there, you know, for a few decades, Americans lost track of breastfeeding and hopefully getting the numbers back up. If somebody from commission staff could on Zoom could grab that link. I'm not on Zoom. I can't
I'm
grab
trying to
that
get
link.
yeah, give me one
It was
second.
just posted. I saw it come up just so that we have it. And I appreciate that. And Ms. Grinstead, you are the coordinator for Access.
I am the WIC manager. I am the manager for the access program for WIC
Right.
only. Yeah.
Yeah, Access WIC. Now the county, and I don't know if somebody else in the room has it today, this is not the only place in the county where Wayne County delivers WIC services. You referenced ACC. I know they're another big one. Do we know how many? Well, we do know how many other locations between besides Access and ACC. I think there's one out in Garden City or something. How many places are we doing WIC services?
So Commissioner, just to let you know, we'll have a full report from the administration on that. They just weren't really prepared to provide a full report today on WIC, but if you have.
No, it's okay. I can
answer.
wait on the report if it's coming.
Yeah,
When I looked at my agenda today and it was, a discussion on WIC services,
right.
an
Yeah, it was
update on it.
originally supposed to be,
Yeah,
you know.
and so I guess my questions on breastfeeding will also be answered in that report coming in a month or so. We don't have to.
Avni Sheth, Medical Director, Public Health. Yes, we'll be speaking
Yeah,
to
okay.
our wider WIC program, and there are 11 locations, including the.
It's okay. I
access
can
and-
wait for the report.
Okay.
I didn't know it was on the way. Because when you get your agenda and it says, an overview or whatever of WIC, and then I know we got a lot of places out there
Exactly.
and we only talked Access. I was like, oh, wait a minute. I know there's more. So we'll wait on the report. Thank you, Madam Chair.
Thank you. And Commissioner Baidoon has one more question.
Yeah, one question.
Mhm.
Yeah, Alicia, another question. Providing this service for 5,700 families, just out of curiosity, what's the annual budget for this roughly in terms of dollar amount? And with the inflation being so high, has it changed from the last couple of years?
We initially started at, it's based on clients you serve. So it's 5,700 clients, our caseload max. We are currently receiving $10.13 per client, which comes out to $692,892. We recently, we're getting $9 per client. And then this past contract we signed for the beginning the 2022-2023 year for a 5-year contract, we went from $9 to $10.13. So we upped it by $1.13, and we service about 30% of the agency caseload.
Okay, thank you.
Am I able to share this information here? Can you see this all as I looked into our income guidelines? Or is it not sharing?
No, we don't see it.
Okay, let me see.
Well, we have the link now. It's the same. It'd be
Yes,
the
did you
same
send us the
information.
link? Then we
Yeah.
can take a look later.
Okay.
Yes.
Okay.
Thank you. Thank you
Thank
so
you.
much for coming today and
Thank
for
you.
your presentation. It was very insightful.
Thank you so much. I appreciate your help and everything and your questions.
All right. You have a good day.
Thank you. You too. Bye-bye.
All right, Madam Clerk, we will move to the next item.
We have an ACC presentation.
Yes, go right
Morning, Madam Chair.
ahead. Good morning or afternoon. Yeah.
Thank you to the committee. We are, aren't we? Thank you to the committee for inviting us. My name is O'Day Fakori. I'm the Chief Operating Officer of ACC.
Summer Korpanik. I'm the WIC Program Manager for ACC, Program Director, sorry.
Different organizations. So
Everybody does, but I didn't.
yeah, right. For the benefit of the committee, and again, you know, being here is a great opportunity to do a quick summary of ACC, who we are. And I know we haven't had this opportunity in a few years. So you'll see our mission to provide core human needs to all people. And over the course of the presentation, you'll feel how ACC has gone from serving multicultural families to growing and broadening our message to be inclusive of all people. And that is our goal now. So next slide, ACC by numbers. This is just a quick summary of last year's numbers. So we've been in business for 42 years. We've had 83,000 clients served. We have over 35 outreach centers, 415,000 services provided. We have 141 dedicated employees. We operate out of 3 counties, Oakland, Wayne, and Macomb. ACC is 80% women. I am very much outnumbered. We distribute over 600,000 pounds of food weekly. That includes food and various basic needs goods. We have 50,000 units serviced, and you know, we've been big on telehealth and making sure that core human needs are accessible. And we redistribute $14 million annually into the community. ACC speaks 14 languages. Again, in 1979, we were founded to be a resource for the Arab American community fleeing war and unrest in their home countries. And now we are proud to say that we not only serve local communities, but refugees of the world. And so we'll get into that a little later. Next slide, please. ACC by the numbers. So if on our annual budget, this is kind of a breakdown of our sources and uses of funds. So you have, that says 23% federal, the majority of our funding coming from state and municipality funding and local foundations in that gray area. We have a 90-10 direct versus indirect expenditure. Next slide, please. Things that just make ACC unique. We provide core human needs to all people so that they may dream beyond survival. ACC established services, government awareness, and subsequent government funding specifically for multicultural families. It was through the effort of ACC, the multicultural line item at the state was established, and that is the line item at the state that all 4 multicultural organizations now are funded by. We started, and you'll see this in a later slide, we've been in business with Wayne County under contract since 2006. And we are a strategic partner with the state of Michigan in the response to the refugees of the world who arrive anywhere in the Tri-County area. So we responded to the Afghan crisis, and this is after settlement. So we are responsible for providing refugees their 90-day health screening. And from there, it's a hub and spoke model where we distribute out various other services. And so some of those other services you'll see in the next bullet, they are offered in our wraparound services across a 5-building campus on 7 Mile and John R. There we provide WIC, infant mental health, home-based behavioral health services, mental health services for individuals, children, and families, youth programs in our gymnasium. our marketplace that's where we distribute our food and various goods, our refugee health services, DHHS social services. We have dental and primary care services, both there and in Dearborn. And we have on-site banking services. So, what we've seen is a natural flow, for example, from refugee services into WIC, and from WIC, a natural referral system into infant mental health. Those who have experienced trauma, and oftentimes it's the parents as well, but all of this is done on our campus there. But I am going to pass it on to Summer, who's going to talk a little bit about our WIC numbers specifically.
Good afternoon. I am going to modify my presentation a little bit because I work closely with Alicia and Nicole, the WIC program manager for Wayne County. So we all do the same work when it comes to the remote services and the history of the last 3 years. So just to save on time, you guys heard that once, I'm going to kind of brief over that. But I do want to point out that ACC WIC's caseload is thriving. This is the last 4 years. If you look at the bottom, that was 18 and 19. We were at 84% caseload before the pandemic. Our 2 locations are located in Head Start buildings. And they, we pull our clients from those communities.
Sorry.
In 2019 and 2020, we jumped up to 89%. Our caseload was 950. Up 2021, we were at 93%, 950 caseload. And then in 21, 22, we are now at 114%, a 10,070 caseload. So we did get an increase of caseload back last year. The reason that we're thriving, I think, is significant. We really worked hard during the pandemic to keep our clients engaged in the program. We also saw, obviously, an impact in the refugee clientele. We went to hotels where they were staying and enrolled them in WIC services. We provided them to transportation to get to our WIC appointments for further appointments. We worked closely with our medical facility to get their health screening done and communicate all their needs. We do have staff that speak Dari and Pashto, so we were able to really engage with the Afghani refugees, and we're now starting to see the same with the Ukrainian refugees. So that definitely, I think, impacted our caseload because we were the primary source for those clients during the pandemic that a lot of agencies just couldn't handle because they were already in kind of crisis mode from the pandemic and being in remote services. Next slide. So this is kind of based on zip codes where our clients come from. So we did talk a little bit, and I believe that we asked the question of, do they have to go in their community? And Alicia mentioned that they have to be a Michigan resident and they can choose where they go. So one of the reasons I think that, ACC was thriving was that we really focused on the client's needs and we talked to them constantly. What do you need to stay engaged with the program? A lot of times the human connection can get lost in all the ins and outs of all the requirements of the program. And so we do a lot of engagement with the clients, asking them, what do you need? And keeping our services client-centered and very customer-friendly, customer service-friendly. We encourage staff to be very empathetic and to find out what they need, not just to check the boxes and go through the program. We try to find out what their struggles are on that day in the appointment and focus on that. So the other area on there covers the zip codes that are not listed. But our River Rouge Clinic is located at 55 Eaton Street, and that is located in the Guidance Center Head Start. And then Highland Park is located at 201 West 7th Mile. And that is near our campus that O'Day was talking about. So we have a lot of services there that clients can walk to other services like infant mental health, the food pantry across the street, youth services. So we do try to, not just give them a referral notification sheet with all the referrals that we list. We try to, walk them over and make a connection sometimes when we can. Last year, River Rouge offered clients 7,208 referrals, and Highland Park offered 2,086 referrals. Some of the referrals that we really focus on is infant mental health. Obviously, there's a lot of clients that can use in-home visits and just some hand-holding to get to doctor's appointments and follow up and make sure that when we identify a need in a health assessment, that they follow up with that and get the child or, the pregnant mom gets what she needs. We also kind of get innovative with some of our referrals. And we partner with universities. We do typically handle 8 interns from the University of Michigan, and we connect with the research platforms that they're engaged with. We offer a partnership right now with Special Delivery, and that is a program that is trying to get home delivery of groceries. So the WIC services right now, you need to go to a grocery store and pick them up. During the pandemic, obviously that caused some disparities because everyone else could do curbside services, but WIC did not allow that based on the program. So this organization is a pilot out of University of Michigan. It's called Special Delivery, and they're trying to get home delivery available to WIC clients so that they can decrease the disparity there. We obviously focus on immunizations, lead testing, all the health assessments. We do have bilingual staff that speak Bengali, Arabic, Spanish, and I mentioned the Dari and Pashto. And we have, I know you guys asked some questions about breastfeeding. So we do the same as Alicia had mentioned, that we contract our peers who are moms who have breastfed themselves, and they provide peer support to our clients. We do have 8 staff that have gone and got professional certifications in lactation services. So we can provide that as well. So it just kind of offers double duty. They don't have to wait for a peer. And the peer is really peer support. It's not professional. So we like to offer that level of professional support as well. All clients have the ability to be referred to a registered dietitian if they need high-risk counseling, or if they just request it. They don't have to be designated as high risk. And they also can ask for a referral to an IBCLC, who is definitely the highest level of lactation support they can get. And then clients do have the choice to travel to the clinic that serves them best. So a lot of times we do get clients that travel quite a ways because their appointment time is less as far as the time they spend in the clinic or even remote services, and the time that they can get an appointment, maybe a day or 2 out versus weeks out. So I know that during the pandemic, a lot of agencies had struggles, and the state contacted us to see if we could assist with some of those barriers, whether it be an ISD, which is an internal referral source from Medicaid. If they apply for Medicaid, they can get referred automatically in our MyWIC system. Some agencies around us had hundreds of clients on that list, and they would ask us to help out since we had sooner appointments. So we really do a good job of managing our schedule and making sure that we can service the clients efficiently and get them in quickly into their pregnancy so that they're not enrolling a baby that's 3 months old, they're enrolling a baby that's 3 days old. And the last slide here, we do have, our clinics are listed in 2 districts, but we serve clients from over 56 zip codes for Highland Park and 41 zip codes for River Rouge. So they really do seek out our services for numerous reasons. Any questions?
You, Commissioner Marecki.
Oh, sorry. Yep.
Oh,
I have just a few more slides, if you don't mind. The next slide, please.
yeah.
That was the last slide for her.
Okay.
And so I, thought I'd take the opportunity to make an ask, but ACC has received modest historical reimbursement rates per participant. ACC started serving WIC clients in Wayne County since 2006, as I mentioned before, where we were getting $90 per participant. That's per year. I believe in the previous presentation, you were getting a monthly rate. ACC's current reimbursement rate is $108 per participant, and it's been like that for the past 12 years. Despite what happened during COVID, during things like the formula crisis, our WIC staff were working tirelessly to make these resources available to our clients. And so it is wildly insufficient. And so I would ask this committee to reconsider ACC's current rate. Thank you.
Commissioner Marecki?
Thank you, Madam Chair. Just a couple questions. What exactly is infant mental health? What does that encompass and what do you screen for?
So that is a program that we have through our behavioral health program. And if you have a child who has like a special medical condition, or if they have behavioral problems, they can be referred. It's similar in regards to MIHP, if you're familiar with that home visiting program, only it's all behavioral health staff. So they may take a client to the appointment. They do get them to speech pathology. And they also provide mental health services. So it can be for a medical reason, it can be for a behavioral reason. It's similar to some of the services that Early On provide, but it's more in the mental health aspect.
So how old is an infant?
So not my program. So I think they go up till 6, and then the wraparound program starts from 7 to 12.
Okay, because infant, you think of infant. So this goes up to like 6.
Correct. They
Okay.
have numerous programs, so one stops and another starts. I want to say that they have 3 tiers, so they can service them up until a certain age.
Okay, so you're asking that we consider 160 per participant. How much would that add up to be for Wayne County's part? You're asking Wayne County to, yeah, so do you know what that final tally would be for the 160 per participant? And the other thing is, does Wayne County get a detailed records of where all this money is spent? What kind of outcomes you're seeing?
Yeah, so we submit monthly. Our accounting department submits all of our expenses. And I know in the last 2 years, they've gotten more strict with actual spending, as well as submitting actual receipts and everything. So our accounting process or department handles it for us, but it's very detailed. I know that in the last few years, the auditors have requested WIC to request from us, and it has increased substantially. So you should know where every penny is spent based on those reports.
And do you ever send any kind of reports for programs that, like, what kind of outcomes you're receiving? What kind of outcomes you're seeing with the monies that we are giving you?
We don't specifically, all of our data goes into the MyWIC system, which is a state-based program. So all of our outcomes are based on the state outcomes, and they can divide it out by county, but we don't typically divide it out by clinic. So we have 2 clinics, Access has a clinic, Wayne County has 9, I believe. So it gets lumped into the community impact versus local clinic.
Okay,
It's just the way that they do the documentation for MyWIC.
Well, I don't want to put you on the spot for the money, but maybe you could send that to the chair and tell us how much that is, since many of us are on Ways and Means. So you're asking from going to $90 a participant to 160.
108.
108 now. It started off with 90. Now it's 108 to 160. Okay, I just would like to know what that is. All right, thank you.
And if we look at that, we would, any increases, then we would most likely have to look at other programs as well to increase theirs. So it's a kind of a trickle up, down. Okay. But yes, definitely get that to us and we can look at that. Commissioner Baydun.
I just want to say another great organization that provides good services to the community. I'm very familiar with this organization as well, and kudos. Thank you for everything that you guys do for the communities.
And thank you. Thank you so much for being here today and providing us with that info. Oh, I'm sorry, Commissioner Killeen.
I'm gonna quit hitting buttons over here. Thank you, Madam Chair. Or I'll just hit Sam's. Since the question of funding has come up, I actually have a question for our department, the county department. We get funds from the state of Michigan to run the WIC program on behalf of the state. Is it the county that sets the reimbursement rate, or is it the state of Michigan that sets the reimbursement rate for WIC providers?
That's Medical Director for Public Health Division. It is a grant program that does come to us for, it's a federally funded grant program that
Yes.
comes through us through the state. And so, yes, I mean, we would have to get back to you to figure out where that whether it falls in the state or dictated at the federal level, you know, we'll have to get back to you on that, how that
It's not us
reimbursement rate.
though.
It could be a combination of what.
Well, it was raised today.
Mhm.
So as policymakers, we need to understand that process, right? Of just exactly how that number for a reimbursement rate is arrived at. And maybe we can talk about that when the report comes in a month or so. But I don't want people having the wrong idea out there. You know, can the county determine that? Is that determined by the state? Is that determined by the feds? Let's get a better idea of how that decision is made.
Agree.
So I was about to leave it there for now, but we'll take more input.
Yeah, I just want to offer some insight. Abdul Al Sayed, incoming director of HHVS. So we get a certain proportion of funds from the state, and we subcontract that out to a number of different providers. The key thing to recognize, right, is that any change in reimbursement rates implies that there's less money to go around everywhere else, right? And so those rates get set at the contracting level. My understanding is that that contract was just approved by you all. And so it'd be worth thinking a little bit about how those rates are set. But just want to be clear, right, that you have some number and the denominator is fixed. So how you divide the numerator changes how much money goes to which providers and how many people you can provide services.
Want to go too far down the road on this today. We get a fixed number.
Our proportion is set by per year, right, based on our population. It's
Okay, in a different discussion, I want to understand that better.
Yeah.
Because I can't do what I can't do,
Right.
you know, as far as the county goes. So I think, Madam Chair, we need a little bit more to know, is this a stream we can step into or is it not?
So,
But,
yeah, we can talk a bit more about that, and
Okay.
we intend to. But I think you're on the right track. Is that at some point, some streams there are costs to step into. So.
yeah, there are. Thank you, Madam Chair.
Thank you, Commissioner. Yes.
There is decided to be an increase and the metrics for which those increases are allocated. Some organizations got an increase last year and some didn't.
Microphone, please, sir.
What are the qualifications of that event?
Okay, well, we will certainly,
The number
Look
is
into that.
55,640 is the increase ask. Yes. You're welcome.
over. All right, well, thank you again for your presentation today. All right, Madam Clerk, we'll move to the next item.
F, such other matters as may be properly submitted before the committee.
So I was going to ask, but I think Ms. Fernandez, she left, but I don't know if you have any information that the new director, Al Sayed, on the juvenile jail, or who can talk to that? I just really want to know if you have any information as to what we're doing with the current situation
Sure.
in the juvenile
Through the
facility.
chair, Eddie Fakori with the CEO's office. Earlier, when I spoke to Commissioner, I did mention it to Ms. Fernandez, and she is expected to include that information with that report she alluded to earlier when she was at the podium. So they are planning to have that scheduled presentation to you all about the JDF itself and some of the services surrounding it. And I shared with her what your requests were, so she's aware of it. I think that has already been discussed at this committee to have them come back in March.
Yes, on another matter, but
Right.
if you don't have any, I guess you're saying you don't have anything right now for us, any update or anything, any information?
Fernandez left and no, I don't from a
Okay.
programmatic level, but I did share it with her at the start of this committee based on our conversation. So she'll be prepared to provide that. And she was expecting to do it. I think she was saying when she was to come back here and provide an update in March.
Okay, we'll wait, but it seems that the situation in the facility, the
Sure.
new facility, there's some issues going on, and we just really wanted to see what is the administration doing
Sure.
to try to
If you want to
correct that.
parse some of that out and send an email to our office, I'll then make sure maybe at another subcommittee in advance of that, we can try to work with the
Great.
department to make that happen. If you
Great.
want to pull that out from what was discussed earlier, absolutely, we'll make that happen at your, maybe not the next, but the following subcommittee.
Great,
Thank you.
thank you. All right, next item.
Public comments?
There any public comments? Anyone on Zoom or on the phone?
Raise on Zoom.
All right, we have no public comments. Next item, please.
Adjournment?